Today's interview for the archives is that of Dr. Max Chamlin, ophthalmologist, who worked for many years with Dr. Leo Davidoff. This is being recorded at Columbia Presbyterian on August the 21st, 1990. Dr. Chamlin, I wanted to begin first by asking you a bit about your family background, where they had come from, and a bit also about your early education.
My family came to this country somewhere between 1908, 9, 10, 11 different members of the family. And on one of those occasions, they dragged me along. I got here in 1910. I was then about 2 years old. And they were just joining hundreds or thousands of other Eastern European immigrants at that time who were looking for a little better life than that they had in Russia, Poland, and these other places. Actually, we came from Belarus, which was part of Russia near Lithuania. I was born in a little bit of a place called Loyev, L-O-Y-E-V, on the Dnieper River, and got here. I was 2 years old, and from that point on, I was one of the New York immigrant boys trying to make his way through this great big city.
You mentioned that you had been raised initially down on the Lower East Side.
Lower East Side. That's I was brought in. We settled in the Lower East Side around near the East River somewhere, where many others were. And in one place or another, I was down 13th Street, 6th Street, 7th Street, Avenue B, C. I was all about 3, 4, 5 years old when we moved to these various places. I don't know why. But it wasn't until I was about 6 or 7 that the family graduated to the Bronx.
That was sort of a decisive step geographically.
Well, it was. It was geographically. It's about maybe 8 or 9 miles up the lower Bronx, and I was over. It was the East Bronx, right through high school. Went to Morris High School there, and eventually we moved across to the western part of the Bronx, which was being built up at that time, and from there I made my way through Columbia College Medical School at Bellevue, NYU.
Well, we were talking yesterday a bit about how you financed your way through medical school, or through undergraduate first. Columbia College.
Columbia College. Well, my father was able to muster up a living. He had no skills when he came here, but he made his way into some small type of installment business and did well enough to buy a nice home and provide me with an education. It became a little difficult around that time, but I was able to supplement my meager allowance with money I earned during the summer working up in the Catskills as a busboy or a musician, whatever they paid me for. And had a state scholarship that helped a little bit in those days. And thus we struggled through. It became a little more difficult at medical school. Times were bad. And
what years were these now?
Now I got out of Columbia College in 1930. And I was
the Depression really had commenced.
It was catching up with us. And about my second year at medical school, I was really having a rough time financially. I had to borrow and pay back when I got through, which I did.
From an individual?
From a few individuals who offered me the money without being asked. I think many of us had to do things that way in those days.
Were there any problems as far as being admitted to Columbia College because of your being Jewish? Was there any quota system?
Well, no, I'm not aware of any limitations at Columbia College. I'm not aware of it. I was not admitted when I applied, and I was told, and it seemed reasonable, that I was not admitted because I was applying for the February term, and they only admitted about 50 or 60 at that time, which seemed to be so. And then they told me if I'd reapply in the fall, and if I were eligible, I'd be admitted, and I was.
Were there any particular teachers at Columbia College you especially remember?
Yeah, and I wish I could remember the names. I wish you had asked me to try to think that my biology
It just
teacher,
occurred to me to
I
ask
forget,
you.
now, but Dr. Carpenter, I remember him very, very well. Professor of chemistry, he was a wonderful man, very good, and he was sort of a guide for the pre-medic students. And Mark Van Doren taught me some
Oh,
English, and he was a great person. He was very, very nice, and he really inspired one who was not literary minded, as I was more inclined toward the sciences, but he aroused a lot of interest in the English language and literature. I loved his books. And then we had a Professor Murray in fine arts,
Yes.
which
He's very well known
were
as
not
historian
very,
of art.
yeah, he was, it was not my dish of tea, but he made it very palatable, I must say. Professor Murray, now why don't I remember Nicholas Murray Butler,
Nicholas Murray
the
Butler.
president. Now Dean Hawkes, Dean Hawkes used to teach us mathematics. He was a great fellow. He'd come out with little cubes and squares and illustrate solid geometry, you know. It's one of my pet subjects.
Had you already decided to enter medical school when you were a freshman at Columbia College? Had you already decided on your profession?
I suppose I did, whether I liked it or not. I mean, it was almost a foregone conclusion that if you were going to get through college and become a member of the elite part of the family, one who went to college, which had never happened before in my family, you'd be a doctor or a lawyer. And heavens forbid it wasn't going to be a lawyer.
You'd already decided that.
Oh, definitely, yeah. I did, I must say that during my years at Columbia, I had some excellent training and teaching studies in biology and chemistry and mathematics, but particularly chemistry. I took a number of graduate courses, including physical chemistry. I forget who it was that gave us that course, but it was taken mostly by graduate students, and there were a few of us that were really interested, and we went ahead and were given permission to take these graduate courses, which we enjoyed very much. I think we had a lot of very good training in the sciences.
The school, medical school that you attended after graduating from Columbia College was the one affiliated with Bellevue. What was its name then?
Well, at the time I went there, it was called University and Bellevue Hospital Medical College.
And it was a private school, not
It was
a
a private
publicly
school,
funded
that's right.
school.
It was a private school. And it was, I believe the names came from, I really don't know, I wouldn't want to be held to this, but there was a Bellevue Medical College and an NYU Medical College, and they combined. I believe we were told that, so that I was a graduate of the University and Bellevue Hospital Medical College.
I see.
Later on, that name was shortened to NYU College of Medicine.
And I understand that there was some restriction placed on the number of Jewish students admitted to the classes there.
Not at the Bellevue.
Not
where
at
I went.
Bellevue.
Oh, no.
That
Oh,
was
no.
elsewhere.
I think this was a catch-all for the good people who couldn't get into the other places.
Oh, really?
Oh, yes.
Oh.
My class was largely Jewish.
Really?
Oh, I'd say it was over 80% Jewish.
Okay.
Perhaps 75, or I'd say.
I didn't know that.
Very much so.
Who were some of the most impressive teachers you recall from medical school, particularly in neurology?
Neurology. Well, neurology. Dr. Brock used to teach us
Samuel
neurology.
Brock.
Samuel
Yeah.
Brock, professor of neurology. Dr. Globus, Yasha Chaim
Joseph
Young. Globus, and he taught us neuropathology. He was quite an entertaining type of a teacher. You know, he had this foreign accent, and he commercialized on it by using it all the time, and it would make us giggle and laugh a little bit. What he would do, he'd have a name for everybody. Now, he'd give you the name of an old pathologist or some old medical name, and I forget the names that he called me, but he would refer to somebody by the name of an old, well-known scientist. Everybody had a name because somebody reminded him of that name, you know, and he used to cause a lot of laughter. He was an excellent teacher. Taught us neuropathology. I think that was in the second year. We had Dr. Cannon, who came over from England in chemistry at that time. He was quite a character. Dr. Cannon, this was his first year teaching biochemistry at NYU, Bellevue, and we heard some reports about him, that he was a tough egg, and he was. Because at the end of the first year, he asked the dean, who was then, I remember it was McEwen, I forget who was the dean at the end of the first year, but he wanted to drop 60% of the class. 60%
Arbitrarily, or?
Because they didn't pass chemistry, he said.
Oh.
Well, they finally chiseled him down to, we lost about 30 people. We lost about 30
Out
people.
of how many?
131, and we were left with 101. And at that time, we took on some people from two-year schools. One of them was the University of West Virginia. It was a two-year medical school. I think there are a few others, I don't remember which. But we did drop 30 people out of 131. Now, I hope those figures are accurate. I wouldn't want to be held to the exact numbers. But he made it very rough for everybody. He thought you ought to be a first-rate chemist, become a doctor. And he was quite an amusing character, too. He said when he came here, he was made professor of chemistry. And one of the stories he told us was that he had congratulatory notes from his colleagues in London upon being made professor in America. And he said at that time he was taking a trip up to Canada, and he stopped for a shoe shine at a place, said, "Professor Tony, bootblack." And he took a picture of that and said, "Well, now don't overestimate this professorship," he says. And he sent them a picture of Tony the bootblack, you know. Professor Cannon, I wish I could remember some of the people in physiology. Dr. Samuel Standard. Samuel Standard was at that time a graduate student in surgery. And part of their postgraduate student surgical training entailed the teaching of physiology. And he was my physiology instructor and a most inspiring person. Wonderful. He later taught us surgery, and many years later, he was the family surgeon.
I see.
And I was his family eye surgeon, too. He was a great man. He was at NYU. He was full professor of surgery for many years, and he passed away a number of years ago. But he was a great asset to the school. He was a great asset. Dr. Samuel Standard.
Internal medicine, do you
Internal
recall?
medicine, now why don't I have a recollection? Dr. McGoldrick was one of them. He was a nephritis specialist, a kidney specialist. I had a little something with him once. He reported me to the dean, and I was bawled out. There's only one problem. They never told me what I did wrong, and I never found out. That's the truth. They just told me next time to do something different, and I don't know what it was. To this day, I didn't ask anymore, and there I was. I got my diploma. But not Mick Goldrick. Mick Goldrick. No, that wasn't. Goldring, I think his name was. He was an internist. Oh, we had one character there, Professor Connery. He was I was tall next to him. And he used to teach us clinical pathology slides, blood smears, urine, and some of the stories that went on are not quite. he used to ask you to compare the color to something or other. He once got a hold of one of the classmates and said, "Now, what color blue would you say that was?" And Manny Fight, who was brought up in New York and Brooklyn, said, "Well, he says, would you say it's like the blue of the water off Cape Cod?" He said, "Well," he says, "like Coney Island," he said. And I'm not sure that Dr. Murray knew where Coney Island was at that time, but I got a laugh from the rest of us. He was a great teacher, Connery. He married one of our classmates, and she was graduated later on. I forget, her name was Tewksbury.
After graduating from medical school, where did you go to intern?
After I got out of medical school, I was admitted to the Fordham Hospital up in the Bronx. This was a city hospital. And now I didn't get in there immediately. My internship did not start until the following March, So I had about an 8-month lapse there. I could ill afford to do nothing. And choice appointments were not available. They were very difficult to come by. So I had my license immediately. As soon as I was graduated, you take your state board exams, and the next thing you know, I got my license to practice medicine. Here was, never having examined a patient. So the first thing I did, I got married. And went on to a summer camp as the camp doctor with 180 kids there. That was
With your bride?
With my bride. That was my honeymoon. I don't know where we accumulated $50, which we had with us for spending money. And it was a great summer. It was very nice. And I think those kids got sterile care like nobody ever gave anybody. I remember once kid came in with a laceration, and they had a nurse there for me too. And this nurse, I asked her to prepare some instruments. I don't know why I didn't do it myself. She took the wet instruments out of the sterilizer and took a dirty towel and wiped them, you know, right there. And I looked at that and I knew this wasn't right. So I re-sterilized them. And then the kid was crying and so forth. So I called in the head counselor. Togo, his name was. He was captain of the NYU basketball team. I said, now, Togo, you sit with him and compose him. I needed a little composure myself. I never saw a suture put in. Well, the next thing I know, Togo was stretched out on the floor. He fainted. We got through. And we had all kinds of things, fractures. But that summer was good. I met a lot of nice people, and we were invited back for vacations for the next few years. And then I took my internship at Fordham Hospital in March.
That was a rotating internship.
Yes, that's the kind I had. You took a rotating internship, and either on the medical, emphasizing medicine or surgery. So that my last 8 months were on medicine only. And at that time, when you're a houseman, in the last 4 months, you really have complete charge of those patients. The attendings are in, and they were in. We had good, solid, practical people. But you were really on your own a lot of the time, and by the time you got to be the houseman, you had a tremendous amount of responsibility, tremendous amount. And we learned a lot. We learned a lot. We did a lot of ambulance riding. Used to sit at the edge of back of one of those little trucky-looking things with a board across the back.
The old-fashioned.
Old-fashioned, and you were exposed to the exterior. If you went inside, you were a sissy, you know. So we had to hang on by a strap held on for dear life.
Like a fireman on an old fire truck.
Oh, yes. And we won't go into those stories.
Well, you were telling me that yesterday that the experience during your internship led to your entry into ophthalmology.
Well, not the ambulance experience.
No, not the ambulance
experience. The Fordham Hospital.
Fordham Hospital.
When I got through at Fordham Hospital, big problem was money again. I needed money to live on. Practice, doctors weren't making fortunes of money, and a young fellow without a practice had to sort of look for ready-made dollars. Well, the city was paying men to work in the clinic, and the superintendent of the hospital was a fellow by the name of Greenberg. He was a marvelous person. He was a wonderful administrator. He had polio. He was disabled. He ran a beautiful hospital, though, and we sort of got along pretty well, and he asked me which clinic I wanted. He knew I wanted the money. I said, well, which one pays the most? And he said, refractions. I said, what's that? He said, oh, examining eyes for glasses, you know. Well, I took that because it paid $5 for a 2-hour session 3 times a week. $60 a month paid my rent for my home and office at that time. So there I was doing refractions with, I was ill-equipped to do them. I hope I didn't hurt anybody, except to give them the wrong glasses. But as I kept on working in the refraction clinic, I started sticking my nose into the regular eye clinic, and little by little began to enjoy watching it, and then I realized that this was a great, wonderful field of medicine, and I started to slip into ophthalmology at the end of 2-3 years. So that this was in 1937 when I joined the refraction clinic. By 39, I was getting steeped in ophthalmology.
Still at Fordham Hospital?
At Fordham Hospital. It's the only place. I had no other affiliation. And I started to stay around for the full clinic. And this was this was at a time when they didn't have many young people in the field, and the three men who ran the service were people in their 50s, good people, good practical people, and they were anxious to have somebody with them. So they appointed me what they called upstairs, meaning you're allowed to go to the operating room and take care of emergencies and so forth. And I just sort of sneaked the back way that way. Gradually got cases, and what I had to do was create a sort of residency. I couldn't afford to. You'd have to just take time out and have money to live on to take a 2 or 3 year residency. That was a little beyond my...
They paid only, what, $15, $25 a month?
The residents, I don't know what they got paid. At Fordham Hospital, I got, the last 8 months, I got $15 a month. That's it. Not enough to buy my cigarettes, which I used to smoke at that time. And,
when did you start doing eye surgery, actually?
Well, now, 1939, I started to do all kinds of little emergencies in the emergency room, and then I left word with them that they were to call me for any ophthalmic case that came in, even if it was 3 in the morning and just a dust particle in the eye. I really created a one-man residency there, assisted at all operations, emergencies, and little by little, these kind fellows, especially 2 out of 3, just let me start helping a little more until I was given a scalpel and made an incision. And in the meantime, I was paying attention to all the resident lectures being given at the Manhattan Eye and Ear, New York Eye and Ear, Columbia Presbyterian, where we are now, Mount Sinai, other places that had organized residencies. And they all had residence lectures given in the evenings so other residents can all come together. Well, I missed none of them. And I started taking some graduate courses, doing cat eye surgery at home, and sort of created an unofficial residency of my own making, shall I say.
In 1943, you took and passed the board
Took my
exam.
boards in 43,
And then skipping ahead a bit, in 1945, you met Dr. Davidoff.
Yeah, by that time I was working at Montefiore Hospital. Montefiore Hospital was a great event in my life. I was invited to join Dr. Samuel Gartner, who at that time was sort of running the hospital. Not sort of, he was really running the eye service. And it wasn't a hospital, it was Montefiore Hospital for Chronic Diseases. It was not really an acute hospital at all.
And Dr. Bluestone was the medical director?
Dr. Bluestone was the administrator, tough man. I suppose he was an efficient administrator. And Dr. Gartner called me. I had applied for membership in one of the local societies. He called me and he asked me did I think I'd be interested in doing eye pathology. Well, I was interested in anything, and especially eye pathology, because I had already taken a course with Bernard Samuels at the New York Eye and Ear, a course which was given in the evenings between 7 and 9. And I used to rush through my evening office hours. This was while I was in practice, after my internship. And I'd rush through my evening hours, and then if there was still a patient in the office at 7, I'd concoct some reason to get out of there. And I'd leave about 6:30, and I took a course with him for several months. It was an excellent, most educational course, and is really an essential for any good clinician, I'd say. Now, Dr. Gartner was doing the same sort of thing at Montefiore, doing all the eye pathology. So when he invited me to come up with him, it was great.
Did you ever learn how Dr. Samuels ever came to know Dr. Cushing?
No, this was a revelation to me, and I wasn't aware of this until you asked me to look through some of the literature I had, and then all of a sudden I come across this obituary which I Xeroxed from the Archives of Ophthalmology, and it was written by Bernard Samuels. I had no idea why. They must have known each other. He must have known about him or known of him. Anyhow, Bernard Samuels was a great person. He was a fine clinician too. That's a little unusual for a pathologist, But he had a great big practice. And
he was primarily a pathologist, or at least.
Well, I think he was just a damn good eye doctor. Everything. He was really a top great pathologist, but he was also a very good clinician.
Well, going back to Montefiore now, you went there in
Dr. Gartner,
43 and had a general ophthalmological practice, I assume,
yes,
with the pathology.
Yes, well, the pathology was sort of a little delectable sideline.
Yes.
Dr. Gartner had a laboratory endowed by the Herrnstadt family, which meant they paid for a young lady to make the slides, maybe $50 a week or something. So we had lots of eyes sent to us from other institutions. They'd have to send them to Columbia, New York Eye and Ear, or to us, or Manhattan. So we had a lot of eyes coming in, and we'd usually get the story with the nucleated eyes. And what Gartner did was throw them at me, and I would sit down.
Not literally, I
No,
assume.
not literally. And I would read them and make my notes, and then he would come in and go over them with me. And this was marvelous. This was, Sam Gartner was a great person, a very low-key, quiet man, and an excellent clinician and a wonderful pathologist. And he
How long did he remain at Montefiore?
Gartner's still there. He's Dr. Gartner.
Does he still go over there?
Oh yes, he lives nearby, and I don't think Montefiore would be right without him. He's still over there looking at the laboratories and whatnot. He hasn't been chief there now for a number of years. They have had, I forget who it was. Well, they have two chiefs since he retired from his chiefship some years ago. But even with the two new men, he was still active in many ways at Montefiore Hospital.
Now, in 1945, Dr. Davidoff had arrived
I think
there.
it was 45, yeah. That was
as the neurosurgeon.
That was a bombshell.
A bombshell.
A bombshell.
For you, for
everybody.
the hospital, for everyone.
Montefiore. This was something new to us. And within a very short time, that great big sign, the big golden letters on the back on it came down, and they took off chronic diseases, Montefiore Hospital. And this was a great thing. And now, on the occasional case when I had a surgical case to do, I'd bring it to Montefiore instead of doing it some other place.
So his reputation preceded him quite a bit.
His reputation preceded him. And when he came, everybody was sort of waiting for this great big thing, you know. And we're waiting to see this man whom we've heard so much about, you know.
Where had he been practicing before?
At that time, he had been at Columbia Presbyterian and at the Neurological Institute, I guess, and he was working here with Dr. Ellsberg, I think, Dr. Stuckey, other people, and then he went to the Jewish Hospital in Brooklyn. Now, when he came to Montefiore, he came fresh out of Jewish Hospital in Brooklyn with a reputation for absolute perfection. If you want to stay on this path and not get mowed down, you know, and it was well deserved. He was that kind of a person. He came to Montefiore, and the first contact with my meager little department, Gartner was the chief, and he was not really head of the department. Our head was another fellow who never came around, but he ran the service, and I was his, shall I say, his underling. I forget what they called me. So Dr. Davidoff contacted the eye department and said he wanted somebody to do his visual fields. Well, the visual fields we were doing then, if we had visual fields to do, we'd throw them down to Ms. Bergen, who was the pathologist, the technician in the pathology. And somebody showed her how to do visual fields, so she would just do visual fields. So when Dr. Davidoff came, he said he wanted one of the members of the ophthalmologic staff to do visual field, sort of the cleanup business, the low man on the rung of the ladder. So I was sent up to do visual fields.
Well, you were sent up first to meet Dr. Davidoff.
To meet Dr. Davidoff. I shouldn't have said to do visual fields. I was assigned to him, see. So first thing I had to do was meet Leo the Lion. Everybody told us that they called him Leo the Lion because he had that sort of a reputation of being a very exact sort of person, not a menace really. And I walked in, I didn't know what was going to, I had never seen him or pictures of him. And when I walked into this room, and there he was sitting behind the desk, a little thin, pale fellow. He looked like he needed a night's sleep. And I told him who I was, and he barely looked at me and said something about doing visual field. I said, well, I knew what they were about, and I don't think he queried me much about visual fields, but he told me what he wanted. And what he wanted was to see a properly equipped room, which he said could not be properly equipped unless you had a 2-meter screen there. Now, I knew about those things, but I had no idea of what it looked like, a 2-meter tangent screen. And with that, he whipped out a reprint, written, an article by some Dr. McLean. I just wish I could remember him. He was Canadian. And he gave all instructions how to construct a 2-meter screen. And that became my guideline. And we had to go to work and build up a place to do. Well, the 2-meter screen, you don't put that in the corner, you know. No. You need a great big room for it. So we had to have room. And where do you get room? In that eye clinic, which was crowded into a little 8-by-10 room, you know. So we went to work and started talking to the maintenance people, the building people, and we discovered there was some dead space in the building. In the old the North building, it's down now. But there's some dead space there. There's an opening into the space, and it must have been about maybe 8 by 14 or something like that, irregular, and a bunch of plumbing pipes and electrical pipes. You couldn't walk. I think there was a floor there of sorts, but it was there was no construction, no room structure. And I became an architect. I told them what I wanted. And they put walls around this place, and that became my perimetry laboratory.
Did you make your own tangent screen?
Well, I instructed them how to make it according to Dr. McLean's instructions. And we used 4-by-4 timbers. And I was told that one of them collapsed and almost killed one of the workers. You know? Years later, I modified the construction of the tangent screen in many ways, and after I became accustomed to it and dependent on it, really, I managed to make a much lighter screen and easier to handle, easier to construct. But nevertheless, it's a great big one.
Dr. Cushing, I understand, expected the visual fields to be charted and on the chart the morning after admission on every patient. Did Dr. Davidoff have that expectation?
Well, no, he never did. But he didn't have to ask me to do it in a hurry. Because when the consult came down from Leo Davidoff, you just did it. Anytime. Nobody had to push me for that. You see, he was very exacting with his resident. But he expected no more than he gave. He was that way. And every morning at 8 o'clock, he had his rounds. Well, he was through with his rounds upstairs with the patients, but he'd come down to X-ray, where he would view all the X-rays, pneumos, and whatnot. And I was there every day. I usually made rounds with him upstairs, too.
Did the residents do the pneumoencephalograms?
You know, you've got me there. I don't know. I would imagine that the senior ones probably did. I don't really recall who did the actual.
I was told also, I forget now who told me, that he had the habit sometimes of sleeping in the hospital after a particularly difficult operation.
Oh, yes, yes. Well, you see, he lived in Connecticut, up in New Canaan, and I'd say it's about a 40-minute ride from there, and sometimes he'd get through very late. He'd just stay over. He had his office there, too, you know.
Yes.
The hospital provided him with a very nice office and a secretary and so forth. And he would stay over at times, yes.
What percentage of your time was taken up by neuro-ophthalmology?
My practice of neuro-ophthalmology was very little at that time, just what Leo Davidoff sent me. And then I started to do a bit of writing with the stuff he sent me, and people began to know a little about me through him and whatnot, and cases came in. But at no time did it comprise a very sizable amount of my practice.
Would you say at most it was about a third at that time?
No, not even that. I would say it was perhaps even less than 10, 20% or 15%, really? Maybe less than that. But when I did neuro-ophthalmology, it was with a zest and with more time than anything else. But I continued to develop my general ophthalmology and my surgery. I was beginning to do more and more surgery.
The neuro conferences that were commenced at Montefiore, approximately when did they begin? In late 40s?
I think that's, well, we had them before Dr. Merritt came, I believe, but my recollection goes back to Leo Davidoff and Houston Merritt and Harry Zimmerman. This was a trio, a trio of strength.
And the head of radiology.
And we had the head of radiology, that's right. The radiologist was very important. Now,
His
originally,
name was what
it was a Dr. Feynman. Feynman, not a very aggressive sort of person. He was a good man. And I forget who else came in there, but Dr. Joel Schwartzman came along.
Dr. Schwartzman.
Joel Schwartzman was a very energetic, competent person and contributed a great deal to these conferences. And then came Harold Jacobson. And Harold Jacobson, well, I think he's still around there somewhere, but he was there a long time and did a tremendous amount of work with Leo Davidoff, including the writing of a couple of texts and whatnot.
Approximately how long was Houston Merritt at Montefiore before he came to Columbia? Just a few
You know,
years?
it would be difficult for me to give you, he was only there maybe 3-4 years,
That's
I'd
what
say.
I
He was
thought.
followed by a fellow by the name of von Storch. Did you know him?
No.
Von Storch. He came along later. And then we had Tiffany Lawyer came along with some other people, but there was a succession of different people after that. But when Merritt left, it was not the same. I mean, they were good people who came along, but there was something about the Merritt, Davidoff, Zimmerman team that was
It must
fantastic.
have been very exciting
Very
conferences.
exciting. We had people coming from all over. And then, of course, you had all us, our vassal slaves, the electroencephalographer. I was the eye man, and then we had the other people that did other supportive type of work, you know. And
of course, the residents.
it was really a great conference. It attracted neurologists, psychiatrists, neurosurgeons, and
People-
general doctors from all over this part of
And people from other hospitals?
Oh, yes, yes. Those conferences was great big ones.
They were once weekly?
Friday mornings, yeah.
I know they can, later on they were still Friday mornings. So.
You mean later on, meaning when?
Well, back in the 60s. Late
Yeah,
50s,
well, you
early
see,
60s.
you see, back when you get to the 60s, I was already preoccupied with Albert Einstein, and
Well, that was when I first became acquainted with
yeah,
him.
yeah.
You were telling me a story of one case presentation where the radiologist and Dr. Davidoff didn't quite agree.
Oh, you mean the one? Yeah, that's when before Jacobson. That was Joel Schwartzman.
Right.
Joel Schwartzman was still is a very fine radiologist. He's retired now, but they came to odds about the diagnosis of one of the. You know, Leo Davidoff didn't really need any radiologists because he was an expert interpreter of X-ray film, but in this particular case. They sort of locked horns a little bit, you know, and well, Leo was the boss, and so I don't remember just what was done about the solution of the problem at the conference, but this was a diagnostic sort of thing relative to an operation that was to be, and it was either a week or two later, I don't remember, whether it was the result of the surgery or the result of an autopsy. I'm not sure which, but Dr. Davidoff came up with the right answer in his own mind, and unbeknownst to Joel Schwartzman or anybody else, Dr. Davidoff announced that he'd like to merely give a follow-up on a certain case, and he reminded the whole group about that particular case where Dr. Joel Schwartzman disagreed with him, and he found that Dr. Joel Schwartzman was, and he repeated the details that Joel Schwartzman was absolutely correct, and he wanted everybody to know that, so they don't get the wrong impression from his misinterpretation. And he came up with that spontaneously, and you know, this takes a lot of
Yes.
guts.
Did it surprise?
Because I could tell you some stories quite the contrary with other people.
Oh, certainly. Did it surprise you, though, or the other people there, do you think, who didn't know him very well?
I don't think it surprised us. He was such
You already knew his
such an
character.
absolute, perfectly honest person about whatever he did. And it would be, knowing him later, I would have been surprised if he hadn't done that. No, this man This man, honesty in his business was most important, most important.
What year did Dr. Davidoff and you go to Mount Sinai Hospital?
Well, that was, I could tell you exactly when. January 1, 1950. Because that's the time when he practically asked me to drop my address near Montefiore and to move down into Manhattan with him. And we did. There's that. Dr. Davidoff, Manny Firing, who was associated with him, and I, the three of us, we got a suite down in Manhattan. And we didn't go to Mount Sinai. We went to Beth Israel there.
Yes.
We went to Beth Israel. And worked at Beth Israel. I set up a laboratory there, started doing his visual fields. And Leo Davidoff took over in Beth Israel. He became an important, very important figure in their structure. And we worked there that way for 1 year. And then at the end of 1 year, he was appointed chief at Sinai in addition to Beth Israel. So now we were divided between Beth Israel and Sinai. And I was still associated with Montefiore because I couldn't very well operate at Beth Israel. My surgical cases, they weren't quite suited for my purpose. And so I was running between Montefiore and Beth Israel and Mount Sinai and my office. So it was a hectic time for me. Now, Leo Davidoff took over at Mount Sinai, and when I say took over, he attracted people from all over again. I'm talking about cases coming in from abroad, from South America, Africa, all over for brain surgery. And we had tremendous conferences at Mount Sinai too, radiologic conferences.
Similar to those at
Similar to those. Similar to those. I never felt quite at home there at that time. There was a certain atmosphere at Mount Sinai, shall I say, that I could have done without. But nevertheless, they had good people there. Morris Bender was there, matching wits with the surgeons. He was a medical neurologist, you know. And
Dr. Wexler
Israel Wexler
was fully retired.
He was retired, but he came around. He was very friendly with Davidoff, and they were socially friendly too. And he'd come around and participate in the conferences.
What was he like?
Israel Wexler? Well, he was a very dignified-looking man, and he was a dignified man. He was
formal.
A little goatee and very formal, very proper. And I really didn't know much about him, but he was a gentleman. He was a good man. I mean, you know, they used his textbook was used for undergraduate teaching, you know, and it was very well known. I didn't have terribly much contact with him. It was occasional.
And Dr. Bender?
Bender. Why do we always laugh when we say Bender? Very bright man, knows tremendous amount of neurology and neuro-ophthalmology, tremendous amount about kinetics of the extraocular muscles and the neuro-rotary system of the muscles, which I was never at home with. And he also claimed to know a lot about visual fields, but he was a very opinionated fellow, and he didn't have a very, he's gone, so he didn't have a great opinion about neurosurgeons. He once said to me, they all die, why operate on them?
The
Just like
neurosurgeons are the patients, you mean?
Patients.
Yeah.
Yeah, no, neurosurgeons don't die, they just fade away, you know. But he discouraged people from brain surgery at times when it was most unwise to do that sort of thing.
Well, in my era, the most notable thing that I recall anyway was his strongly suggesting in a few articles delaying or avoiding surgery for chronic subdural hematomas.
Oh, you mentioned that to me.
And someone else in neurosurgery told me that a number of instances occurred where patients with this medium of treatment would collapse, go into coma, decompensate,
And then they'd call the nurse.
and either die or be operated upon with or without success at the very last minute.
Yeah, I never quite understood Morris Bender. Personally, I had very little contact with him. One or two cases which were kind of silly. I mean, he expected the impossible of people, and I didn't encourage myself to.
How did he and Dr. Davidoff interrelate professionally?
I don't know. It was not Houston, Merritt, and Davidoff. It was not the same sort of thing at all. Now, there was Bender had a sort of a daring position. I dare you, you know. That
So
sort
with
of
Houston
thing.
Merritt is more a give and take.
Well, with Houston
mutual
Merritt,
respect.
these were intellectual equals, and who gave of each other, gave to each other. They shared everything.
Yeah.
It wasn't a matter of competing or disagreeing, you know. And this was great. This was marvelous, you know. I guess those Montefiore conferences are something that I'll never forget. Nor do I think anybody who attended them would ever forget. Years later, I used to have people, doctors, whom I barely knew that might send me a case or something, and they told me they used to attend those conferences, you know. People from upstate. I remember a neurologist used to come down from Peekskill. He sent me some cases later, and he told me he never missed one of those conferences.
Well, during this period, there were stirrings about the creation of a new medical school.
Well, the stirrings turned into a great big thing. The first Jewish medical school in this country, founded under the auspices of Yeshiva University, which was primarily an Orthodox type of Jewish organization, and the president was President Belkin. Now, Belkin became president of this tiny little yeshiva university years ago and built it up into a college for men and for women and other things, but they never had a medical school. And some of them decided that there should be a Jewish medical school, number one, because yeshiva should have one.
Who originated the idea? Was there any one person or several people?
I really don't know. I really don't know. But you see, it was also not the easiest thing in the world for a very bright Jewish medical student to get into a top-notch medical school. And they were scattering all over Switzerland and Scotland and any place, Italy.
There was one school in Chicago that was
I remember,
established,
but it was not quite as completely Jewish, I think, as maybe they were run by a lot of Jewish people. But this was under the auspices of a religious organization. I heard about the Chicago Medical School. I didn't know much about them. We considered ourselves the first Jewish medical school. And they thought we should have one like that. And the campaigns, the fundraising became tremendous. And Leo Davidoff's name was one of the greatest attractions for these fundraising parties. Because at that time, everybody knew who Leo Davidoff was, even if they never heard of anybody with a brain tumor. And he was probably the best known name among Jewish doctors in the country at that time.
So quite early on, he became interested and enthusiastic.
Well, yes, he was just about ripe for that sort of thing. And Harry Zimmerman spoke to him. Harry Zimmerman was very influential in the forming of that school. And he spoke to Leo Davidoff, or maybe it was the other way around. I really don't know. But these are two very prominent people. Zimmerman was not known to the rich donors. I mean, he's a pathologist, but Davidoff was known to all of them. Perhaps he operated on the families of many of these people, you know. So there was this get-together of Harry Zimmerman, Leo Davidoff, and a few other people, less well-known than these people. And the fun began. It was all over the place, making speech here and there, raising money. And before you know it, Leo put his arm around me one day and said, how would you like to head our eye department, or something to that effect? It was almost frightening. This new medical school. And I was...
Was this even before the foundation stone had been...
before what?
Before the foundation stone, before breaking
ground? They were beginning. They were talking about a foundation then, and this was beginning. Oh, before, yes, yes. Well, of course, I first of all I wouldn't dare to say no to him, even if I didn't want it, and When he said something, you just did it, you know. I remember years before, he thought I ought to run the hip group up at Montefiore, and I hated that because I had a pretty good practice at that time. So he said, no, you got to take care of those hip patients. I did.
Hip?
Hip, you know what that is? Health insurance plan.
Oh.
People pay a certain amount of money and you take care of them in your office. And I was getting kind of busy for that. So without telling him, I just handed it over to somebody else about 3 months later.
I see.
We never discussed it again.
I don't
But when
blame
he
you.
said about taking this job at the medical school, I knew this was a big thing and we had to do something about it. And I was flattered, of course.
Now, Dr. Zimmerman at that time had asked Dr. Einstein about the name. And Einstein, why me? I'm a physicist.
I know.
And so Dr. Zimmerman said, well, how about the Goldberger School of Medicine? And Einstein said, who's Goldberger? And Dr. Zimmerman said, now can you imagine anybody asking, who is Einstein? And that's when Einstein turned to him. He said, did you tell me you're a physician or a lawyer?
To Zimmerman?
Yeah.
Yeah. Well, that school came about, and after Leo Davidoff spoke to me, would I like this or that or the other thing, and by this time Marcus Kogel had taken over from Zimmerman, and he invited me up there, and I visited him at the school headquarters, which was a little bit of a wooden cottage alongside the ground that they had bought. And I visited him there, and he took me for a walk. He says, I want to show you the medical school. He took me across the street, and there were a couple of bulldozers, a big hole in the ground. He says, there's the school, he says.
What was his background, by the way?
Marcus Kogel was a fantastic man. He was an administrator, really. He was an army man. He was very well known to people in the Army, in the medical corps, because he gave some very popular lectures on mosquitoes or the fly or something. I never heard them myself, but I know everybody used to sing his praises. He was a marvelous teacher. He was the commissioner of hospitals. Now, that's a big thing. And he probably was in on the planning of these 2 hospitals, Jacobi and Van Itten, which were being constructed at that time prior to the knowledge that there was going to be a medical school. This was being done by the city to replace the obsolete Fordham Hospital. My dear old Fordham was going to be turned. It was old and decrepit, you know. And this was not too far away from Fordham. So Marcus Kogel was commissioner of hospitals. So he became the first real working dean after Zimmerman. And he took me down to show me this great big hole in the ground, you know. Said, that's the school. How would you like it? Said, it looks fine.
How long did he remain dean there?
Marcus Kogel, he was dean through many years, through all the trying years of building up of a 4-year school with excellent accreditation, marvelous records by students, gathering of a big faculty, grants. How the man did it, I don't know, because...
Is he still alive?
No. Marcus Kogel, he was dean for about, I'd say about 7, 8 years, maybe 9 years. He was succeeded by 2 or 3 other people, none of which really were suited for this sort of thing. And I think one of them was a dean against his will. Eventually they got a person who seems to be running things now. Marcus Kogel had one assistant, Joe Hirsch, who was not a doctor, but he was a sort of an associate. I don't know what they called him. And then he had one man who maneuvered all the money business for the school. And Perlstein, Mr. Perlstein and Joe Hirsch and Marcus Kogel ran this tremendous organization. And it was marvelous. Whatever had to be done was done without much ado.
And they worked well together.
Oh, they not only that, but they worked well with the faculty, with the students. But then, of course, since then we've grown, improved. So now they have about 15 deans or what, I don't know. But I said,
Is that an improvement?
I'm sure they don't have the smooth running that we had at that time. He was a great guy, Marcus Kogel. He really built that school
Well,
up.
what year did Dr. Davidoff and you and Dr. Firing move your practices to Albert Einstein?
Well, I never moved my practice up there.
Not
I kept my
entirely.
Manhattan office for the rest of my practicing years.
You didn't even have a branch office there?
No, no, I I never gave up that practice. I was made full professor and chairman, and but I told them I would never give up my office.
I see.
You know, they have an ad now. I'll never give up my Cadillac. I said, I'll never give up my office. And then there came a time when I just felt it was much too much for me to handle, and when I resigned from the job. But the year we moved up, I would say there was about maybe, the first class started in 54. They 55. They graduated in 59. I'd say that Leo and Manny probably moved up around that time, but Dr. Firing didn't. Just Dr. Davidoff did. Dr. Firing had an office of his own in Manhattan, and I maintained my offices right through in Manhattan, right through until I retired completely. I changed my office once or twice, but Leo was the only one. Leo Davidoff was the one that moved up to Einstein, and before we had our college hospital up there, he went back to operate at Montefiore, which was just 10 minutes away, you know.
You didn't use the hospital at Albert Einstein once it was constructed?
Oh, yes, as soon as it was built. As soon as it was constructed, I don't remember what year it was. It was in the 60s. And when that was built, we were in on the planning, and these were other nights of planning and architects' consultations. And I used to go out to see a certain architect who lived in my area, and I kept plugging away at him for plans until one day he said to me, you know, I get paid for this sort of thing. We had no money for that. But we started off with plans for $7 million to get a 200-bed hospital. I was on the committee, being one of the cutting doctors myself. I was doing my surgery then at Montefiore, and there were a few others on the staff, some of them who never treated patients in hospitals. That was a bit of a mistake. But by the time the hospital actually started being built, that $7 million went up to $32 million. That's how things were moving in those days. And then, of course, as soon as the hospital opened, I did all my surgery there, and Leo Davidoff did it all there. And Dr. Barsky, the plastic surgeon, he was on our staff. He was pretty well known.
When did you start your residency program?
Well, as soon as we started our first class, that was 55. But in 54, we had Jacobi Hospital moving already, taking some city cases in. And I had an eye service there, and an ill-equipped office of sorts. And I had to get a resident. So there was a residency, no private cases, not even it had no eye cases to speak of. So I had to offer a residency to somebody who wasn't going to get anything to do except to hang around. And I got a fellow from Mexico. It turned out to be a very gifted young man who took part in some of the research projects we worked on, and later on we had patients and built up a service. And that was a man from Mexico, and at the end of 1 year I took on 2 or 3 more men, and by the time I left there I had a 10-man program.
We were talking earlier about the impression doctors had, particularly medical students and residents, of Dr. Davidoff. You had mentioned the term Leo the Lion, that leaves an impression of a very formidable, intimidating, rather frightening person. Yet outside the hospital, outside the operating room, he had other interests.
Oh,
and,
yes.
also
Well, before
was
we
quite a
leave that,
different
before we
person.
leave that point, I wouldn't like you to leave the impression that he was really intimidating and fierce as a lion in any sense of the word. I think there was an intimidation that people acquired in his presence because they knew about his ideals and perfection, and they felt that they could never perhaps satisfy him or live up to it, and maybe that caused a sort of intimidation. And I think everybody felt that sort of thing because he was known for his excellence of performance and what he expected of people around him, and he got it. Now, he had many other interests. He was a great gardener. I remember the first time we went to visit him, I stopped to ask some guy on a tractor bare-waisted guy with a pair of jeans, how I get to the Davidoff, and he turns around, and there he was. He was on the tractor. He used to work the tractor and did all kinds of work in the garden, and he liked to do outdoor work of that kind. He loved to cook. He was a great man with the barbecue and the grill, you know, and a wonderful host.
You said he used to kibitz your cooking, or your
Oh,
wife's
sure,
cooking.
my wife's sure.
Yeah.
If she was making something, he'd take a look and say, "Did you put enough cinnamon in?" or something like, you know, all about that sort of thing. He was a baker. He used to bake cookies, cakes, and Christmas time, they used to have all kinds of decorations, including a Christmas tree. And if you were invited, he'd have cookies shaped something to signify your shape, you know. Well, I was pretty paunchy at that time. I guess I still am. But he had a cookie for me with somebody with a big fat belly, you know, and one for the kids and so forth. He was a bit of a poet, I think I told you about that little poem he wrote in accepting our invitation, and it was clever, you know. And then he did things like, he once cut patterns for dresses for his girls, Ida told us.
I didn't know that.
Yeah, he extended his expertise to that sort of thing. He also did some painting, sculpture, had all kinds of interests
Well,
like
after
that.
the end of World War II, he went over to Europe, in Central Europe primarily, I think, Czechoslovakia, Poland, Hungary, perhaps,
And Israel.
and Israel, to lecture and to help
Spent a
make
lot of time
plans for restoration of the medical services in the university
Yes,
schools.
yes. He did a lot of that. And then I think he made another trip to Israel where he actually participated in the building up of their hospital and
Hadassah.
neurosurgical service, as did Dr. Samuel Standard, about whom I spoke earlier, if you recall. He spent a lot of time up in Israel building up the surgical service too.
Was that at Hadassah?
The Hadassah Hospital. And then later on they had the, I forget the name of that other place, well, they had several other hospitals, but Hadassah was the big one, of course.
I think Dr. Zimmerman also is.
Oh, yes.
Made quite
He
a
was
few
very
contributions.
influential in building up their hospitals and things. And they also, I'm sure they were all these people were instrumental in raising money for Israel in many ways. Yeah. These people extended their expertise to places other than their own practices.
It's a dimension of which we know very little about our colleagues, except within the hospital environment, their practices, and of course as we encounter them at meetings, but often do not get to know them as individuals. I think this is an important aspect of a person's personality. to
Well,
know something
I guess
about.
some people didn't really know him very well. They knew him as a stern perfectionist in the operating room, or in the X-ray at the X-ray conference or something. But he was a very, very wonderful, sociable kind of a creature. He was a great raconteur of stories, and
You said he was very good at telling stories in dialect as well.
Well, not Yiddish.
In Yiddish.
Call it a dialect.
Well, there were several versions of Yiddish.
Yes,
so
of
you
course,
said,
of course. Well, he spoke the kind of Yiddish. I was well accustomed to Yiddish of various dialects, as you say, and his was the kind of Yiddish that I used to hear on the Yiddish stage. So this was an intellectual type of Yiddish. It was good Yiddish. And he was a great storyteller, Yiddish stories.
Now, he was from Latvia originally, and my understanding of the relationship between Mount Sinai and Montefiore was that it was close, sort of.
Yeah.
Montefiore is sort of the younger brother or younger sister of
Shall I
Mount
say
Sinai.
a poorer cousin?
A poor cousin? Okay.
Well, you see, we were Montefiore up in the sticks of the Bronx for chronic diseases.
Yeah.
But the real stuff was done at Mount Sinai. It was the same group of rich Jewish families that gave money to Sinai and Montefiore.
I see.
See, and they had good people, chiefs at Montefiore and all that. But it wasn't the same as Mount Sinai. When Leo Davidoff got to Montefiore, that was a complete change of atmosphere. This became a great big hospital.
You had mentioned something that I had not known before, had no way of knowing before. In the late 50s, I think you said you and your wife were attending a ceremony where Dr. Davidoff was making a speech, and you made some observation of slowness in movement and paucity of eye movement and all that.
I mean, don't hold me to the year, but at that time, when Leo Davidoff was received an official appointment from the president, he was the chairman of the Department of Surgery, and as such was responsible for all the surgical services, including general surgery, neurosurgery, orthopedics, ophthalmology. Well, we later split off, and I had my own service. But general surgery split off too from him. It was a service of its own, and he had promised that to a young man, David State, who came from California. He told him that at the end of a year, if things were satisfactory, he'd make him professor and chairman of his own department. And so he did. There was a little dinner party at that time, and we attended it up in Yonkers. I think it was some outdoor restaurant. And Leo made a speech with the proper presentation of the department to David State. And while he was talking, I was looking at him, and I'm not a neurologist, and I'm not going to say that I knew how to diagnose certain things because I was in the field of neuro-ophthalmology, but it so happens that my grandfather had Parkinson's. And as a medical student, I made a very profound study of the very earliest signs and symptoms of Parkinsonism. And while he was talking, I noticed a lack of fast movement that he used to have, and a lack of motion of his eyes. He had to turn his whole head sort of. And I kept looking. I said, there's something off. And I whispered to my wife, I said, I think Leo has Parkinsonism. She looked at me like I was crazy, you know. I didn't dare say it to anybody else. And it wasn't until a few months later that he once said to me, he says, you know, I feel a little stiff. He says, I don't move like I think I've got arthritis. Well, it was a few months after that somebody...
Just months?
It was less than a year, because it was getting... and I recognized it. I'm sure other people did too.
And that must have been about 65 or 66. Because I think you retired from clinical neurosurgery in 67.
You know, I'm just embarrassed to tell you that my placement of things in time is very bad. I just don't remember well. It was toward the end, and he was still operating at that time. He was still doing his craniotomies.
Yes, I think he quit the summer of 67.
That may well be.
I think his last operation, I may be mistaken about this, was an operation for trigeminal neuralgia.
Oh yes, that was one of his favorites. He was one of the few people that did some of that surgery.
Going back to your own career, though, you left Albert Einstein in 69, and then you retained your private practice up until 1982.
Right.
And where were you primarily operating at that?
At that time, I was invited to join the New York Eye and Ear Infirmary down Manhattan, and it was really a great privilege for me. They expected very little of me. I would deliver some lectures to the residents or see an occasional case for them, but basically they were just being very nice to me. And having been an instructor there many a time, and having had a lot of friends, I had a wonderful place to operate, and it was an excellent place to operate.
You were also secretary for the section of ophthalmology at the New York Academy of Medicine some years back.
Yes,
and
that was in the 60s, I believe. That was quite a responsibility. The big job was to arrange for programs, getting people from all over the country or the world at the New York Academy of Medicine.
How many residents in all do you believe remember training now in ophthalmology?
In ophthalmology that I trained? You know, someday I ought to count them. Because the other day I had dinner with one of my former residents, one of my boys, as I say. He's about 60 now, and he reminded me of a few people. I don't even remember their names. I imagine maybe about 30 or so more, perhaps about that. Perhaps
Today, with so many of the electronics in medicine, and especially CAT scanning and MRI, visual evoked potentials, other diagnostic techniques available, is there still a role, or is there rather still a need for the more traditional neuro-ophthalmological investigations, such as visual fields? Do they still play a part?
Well, they still do visual fields. I don't think they have the significance that they had before, because I remember when Leo Davidoff would depend on a slight homonymous hemianopia and nothing else to give him sidedness, and at least he knew which side to do the angio on. Now that was very important then.
Yes, certainly.
See, and it was very important. Visual fields, as far as chiasmal interference is concerned, I don't think anything will replace that, unless they stop doing radiotherapy or operating on them. But to me, there's nothing to replace the study of visual fields for chiasmal interference.
What do you feel a resident in neurosurgery should possess in knowledge of neuro-ophthalmology, more specifically, before entering practice?
Well, I certainly think he ought to acquaint himself with the normal ophthalmal disc in the eye. He should be able to look at an optic nerve, the head of an optic nerve, and to know that he's got normal margins, discrete margins, and that there isn't any papilledema. To understand that if he sees a very pale disc and there is no history of glaucoma, that he might suspect a tumor pressing on that optic nerve. I mean, he should know to recognize an abnormal disc, a blur disc, an atrophic disc, or a cupped disc. If he sees a white disc which is cupped, he should know that perhaps the headache in this man is not in his line, but glaucoma, which the patient doesn't know about. I think they should know about discs. They should also learn that they must look at the peripheral retina. You never know when you pick up a few things in the periphery that give you a story. And as far as visual fields are concerned, I don't say they should become expert perimetrists, but they should certainly have some idea of examining fields by confrontation, at least. Do you see my finger or don't you, or something like that. But they should have some idea of visual fields, I think.
And also some understanding perhaps of the fields that they're presented with, done by someone else.
Oh yes, of course, interpreting the...
Whether or not they appear to be compatible and consistent.
With the other findings and the story.
Reliable, yeah.
I think this goes not only for neurosurgical residents, or all doctors. Great big history. I always used to advise my residents, when they take a history, close that door. You don't want to be disturbed for 15 minutes, but just let them talk away. You let them keep talking and talking, and ask as much as you can. Try to get a history down, a very good, well-taken history, and especially by an intelligent patient, sometimes much more valuable than a lot of those tests you're going to do, which may be very needless, you know.
And expensive these days, more and more.
Expensive.
We've run out of time pretty much, and we've left out a number of people whom you came to know or meet over the years. Sir Jeffrey Jefferson, Norman
Jefferson.
Dott,
Yeah, these were great names in neurosurgery. I met these people at one of my little jaunts to Europe. They were great names. Leo was a great friend of these people. He knew these people. They all respected him. He had a great name amongst neurosurgeons.
Yes, he did.
Yeah. Great name among neurosurgeons.
Would there be any, just closing, any 2 or 3 books you feel that most any neurosurgeon would do well to have in his personal library related to neuro-ophthalmology specifically?
I'm afraid I can't really answer that. I'm not well enough acquainted with recent contributions in that field.
Do you
My
feel that
Bible was
Tracquair's book
Tracquair
should be
was my Bible and for visual field study.
If it's out of print, do you think it should be reprinted?
Well, if it were out of print, I would find somebody that, yes, I think it's a good idea. Tracquair there's really very little new in visual field work. If you look far enough into Tracquair, I was a little astounded to find some of my tremendous discoveries that I thought would shake the world. And there he was just quoting these things. It was a fantastic book, Trackware.
I found a similar experience in reading earlier than I had Trackware, Gower's Medical Ophthalmology, written in, I think, 1888 or something like that.
Fantastic, isn't it?
I learned an awful lot of things that I thought were new and were not so new. He was a very careful observer as well.
Trackware was an absolute genius. And coming from a person like myself who lived with tangent screens and test objects and trying to find field defects, very early signs, and when you reread Trackware, you can realize what an enormous experience he had.
He worked closely with Norman Dott in Edinburgh.
Right.
I just wanted to close by something I should have included at the beginning. In many ways, you were, in spite of the small percentage of your total practice devoted to neuro-ophthalmology, one of the earliest neuro-ophthalmologists, using that in an unstructured sort of way in New York City.
Well, yeah, I suppose so. There weren't many that were, I guess not too many people had the opportunity to do the kind of work.
Well, there wasn't much of a living in it.
Well, that's another thing. I certainly never depended on my neuro-ophthalmology to pay my rent.
Yeah.
Never.
I just want to take this opportunity to thank you very much for your providing this interview for our
You're very
archives.
welcome. You've brought back some very, very fond memories for me.
Well, they're very important ones for us to keep on tape over the generations to come. This is the type of material that doesn't end up in articles as a rule, and certainly not in textbooks.
Well, I'm very happy to
Well,
participate.
thank you very much.
Thank you.